So next speaker is Dr. Parul Chawla Gupta, and she will briefly discuss the recommendations. Dr. Parul.
May I request Professor Pandov sir to introduce Dr. Parul?
I think Dr. Parul is associate additional now, additional professor now at PGI at our institution, the Advanced Science Center, PGI Chandigarh. I think she is a wonderful clinician, teacher, and also a great researcher actually. And not only that, she's very much community oriented. I think she has probably organized the maximum number of camps for us in PGI, because PGI is being mostly a research institution. Those public duties sometimes are kind of they are not in our mind, but I think she's the one person to whom we go to when we have to organize some public function or that kind of thing. So I think she's doing a wonderful job for us. Thank you.
Thank you so much, sir, for your kind words. Good morning, everyone, and all respected teachers on the dais. Today I'll be reciting the recommendations. So the report of the National Symposium at 8th National Assembly of 40 on 12th January 2025, which was conducted in Chandigarh, PGI Chandigarh. The National Symposium was held on 12th January 2025 with the goal to discuss improvisation needed in teaching methods to improve PG teaching. There were 6 speakers, all were senior, experienced and renowned teachers. The symposium started with the keynote address by Professor J.S. Tetyal, former Chief, RP Center, AIMS. He talked about the future directions for the PG course. He suggested course can be divided in 6 segments. First segment is proper orientation in the department for 3 to 6 months to understand working pattern in the department. Second segment is basic classes with special focus on optics and retinoscopy, which is a must know for every PG. Third segment is start workup of a patient with history taking, a very important step of an examination. One checklist for history taking can be prepared to avoid missing even a single point. Orientation classes should be taken by faculties rather than SRs for torchlight examinations. PGs should be explained about how to deal with the patient, importance of a good attire or well dress up, proper accurate documentation of the case in the form of colored label diagrams, check for logbooks at regular intervals to check the progress of a student. Fourth segment was hands-on training in dry labs as well as wet labs before actually starting surgery on a patient. Simulators in dry lab give good exposure to steps of the surgery. In wet labs, surgical steps practice can be done on goat's eye. Once they master the steps in labs, they can assist seniors to get acquainted to OT and then start actual surgery on a patient step by step under observation. They should keep recordings of all the surgical cases to get reflections of the surgery and to improve it in future. Fifth segment is academic involvement, guidance for symposium preparation and presentation by faculties. We should motivate them to participate in national and international conferences. Thesis must be of high standard to get it published. And if possible, take help of the research grant for the thesis. Sixth segment, practice for preparation of a good performance in examinations, and that can be conducted every 3 months in the form of practice like OSCE, paper writing, grand viva and refraction. For discussions, they can form a group amongst colleagues for group discussion with peer mentorship for guidance. At this stage before exam, future career orientation sessions can also be done. Second speaker was Professor Anita Panda, who talked about the role of professors in medical education. There are many changes that are evolving in education like telehealth, e-learning, in curriculum development, clinical practice and integrated education. Workshops can be conducted for the teachers to get involved in this evolving education system. Third speaker was Dr. Tarun Panda, who discussed newer modalities in teaching and training. He suggested integration of technology may be online in live surgeries, wet lab, focus on research and subspecialty training. There are many challenges in integrated teaching, interdepartmental discussions and use of teleophthalmology, remote learning, mini clinical evaluations. Special focus is needed on public health and community ophthalmology. Innovation challenges can be overcome with collaboration with engineers. To get global exposure, exchange programs can be arranged and mentorship programs can be arranged for personalized learning. Fourth speaker was Dr. Guru Prasad, who discussed his own method of teaching. Aim of teaching is to make students do and learn. Teachers must have patience, empathy, and follow ethics. We cannot forget our orthodox teaching methods. They are the best for history taking and examination. It is very important to master torchlight examination, RAPD testing, refraction before learning subspecialty equipment. They must fill logbooks, learn video editing and wet lab training to understand and master the procedures fast. BLS, basic life support, and advanced life support training should be given to all. Community work in outreach programs can be made mandatory to all. It is very important to check physical and mental health of the PGs before admission. Fifth speaker was Dr. Raman Rao, who talked about OSCE for undergraduates and postgraduates. OSCE must be based on competency, knowledge, and skills. For undergraduates, there should be 5 stations with 5 marks each, and for PGs, 5 stations with ocular histopathology, imaging modalities, visual fields, communication skills, and refraction should be there. It should be a summative assessment. Sixth speaker was Dr. B.K. Gupta, who talked about newer modalities of teaching, learning methods, innovative interactive teaching methods like SDL, making lectures interesting by flipped classrooms, games in between lectures, group discussions, role play, sandwich technique and quiz should be done. Student feedback plays a major role to improve the teacher interaction. Adopt mobile ophthalmoscopy, video slit lamp imaging system to learn surgical steps. Virtual simulators are the best. Seventh and the last speaker was Professor Bhavna Sharma. She discussed training is not enough, assessment leads the way forward. She mentioned lacuna in competency-based approach. It is not exactly followed. We need to focus more on competency, attitude, and communication skills. 360-degree assessment is essential in diagnosis, surgical procedures, and academic activities. Assessment should be regular, ongoing to assess knowledge and difficult domains. They must know how to take written consent, do proper counseling, and must be available on call for emergency. Milestones and assessment based on patient care, system-based learning as Ayushman system, practice-based learning with mentor and communication skills should be followed. Thank you so much.
Thank you. I think there was a lot of discussion in the last meeting, and I think the experts they have actually recommended what is need to be done. So this is quite a kind of in line with what the National Medical Commission actually also recommends. And but the issues are that when at the implementation stage, sometimes we falter out for various reasons actually. And those reasons are common to some of them are common, some of them are actually unique to different different institutions. So basically, we need to see how we can standardize the implementation part also across the nations. Yeah, thank you. Dr. Dalia.
Thank you, Dr. Parul, and thank you, sir.